Hello, I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are eh-yah,
Black and brown women disruptors in healthcare and beyond.
I will take my time. The words of the House Minority Leader, Hakeem Jeffries, as he is using his magic minute to draw out debate on the Republicans' mega bill and express Democratic opposition to this sweeping multi-trillion-dollar policy package. Let's roll the clip.
Republicans were so proud of this one big ugly bill. Why did debate begin at 3:28 a.m. in the morning? Republicans are once again, which has been the case, Mr. Speaker, through every step of this journey, tried to jam this bill through the House of Representatives under cover of darkness. But I'm here today to make it clear that I'm going to take my time and ensure that the American people fully understand how damaging this bill will be to their quality of life.
And so Dr. Brown and I are calling out the big, ugly bill that's been celebrated by the same folks who have never, you guys, waited 6 hours in the ER, filled out Medicaid forms, renewal forms, or maybe they've never even buried a loved one because they couldn't afford health care. So let's start here. A major healthcare bill it's about to be passed in Congress. I mean, unfortunately, we're talking about this now, and they're calling it the bold, bipartisan, and beautiful. Are you kidding me? I've read the fine print, and from where I sit as a Black woman who is a physician surgeon, that I'm the middle class, right? But I grew up as a daughter of a working class. My mom was a nurse, paycheck to paycheck, and my stepdad was blue collar. So this is brutal, not just because it's big and they're calling it beautiful. We're calling it ugly, brutal, and now dangerous. They're selling this cost-saving measure, but what it does really, it shifts the cost back to low-income families, uninsured, and people who really already, guys, are hanging by a thread. So today, let's call it what it is. We're walking through these real factual concerns that Democrats are, some of them, worried to say it out loud, but we will here on MeidasTouch. Nearly 12 to 17 million people, Americans, are expected to lose health insurance because of the big, ugly bill. And Dr. Brown, that means 2 million people in the rural areas. Let's roll this clip.
One of the biggest battle lines when it comes to the president's tax cut and spending bill are the cuts to Medicaid and the very real impact those cuts will have on millions of Americans, especially in rural communities. Nearly 12 million Americans are expected to lose health insurance with this bill. That includes almost 2 million in rural areas. And one report estimates nearly 400 rural hospitals would be at risk of closing if the proposed cuts go into effect. I want to play for you what one Democratic congressman just said what this will mean for his community.
So 35 rural hospitals in my state are going to close, and we know what's going to happen. People are going to get hurt. Children are going to have accidents. People are going to have heart attacks. When minutes matter, they are going to have to drive an extra 30, 45 minutes. That is the difference between life and death.
Life and death, Dr. Brown. Life and death.
It's life and death. And let's be real and let's be clear. You guys, this is not reform. It is a controlled demolition of Medicaid, repackaged as those famous words, fiscal responsibility. Representative Morgan McGarvey put it plainly. This bill caps Medicaid growth in real dollars, forcing states to pick up the slack. And if you live in Texas or Mississippi or Georgia, you already know what happens next. Services get slashed and people fall through the cracks. Now, we're not talking about theoretical harm. We're talking about families who depend on Medicaid for cancer treatment, for maternal health, for pediatrician visits, and for mental health care. So when you cut from the bottom, that's not efficiency. You guys, that's an erasure of the working class. Hospitals across the country, especially safety net and rural hospitals, are sounding the alarm. This bill slashes nearly $1 trillion, trillion with a T, from Medicaid, gutting support for the very institutions that are tasked with caring for our most vulnerable. And don't forget that it's not just the hospitals. It's the clinics. Medicaid pays physicians and providers to take care of people, and they will not be getting funding for that. And when you already have these underfunded clinics and underfunded hospitals, they become overwhelmed when you have ERs filled with patients who can't access preventative care, right? They can't go to the doctor's office. They don't have Medicaid. And so what happens is that financial strain, it doesn't disappear, right? It gets shifted onto those who are insured. So patient comes to the hospital, they're sick and dying, they will be cared for. The hospital absorbs that cost to a certain amount. But then what happens is they shift it onto those that are insured. And that shows up as higher insurance premiums. You're more out of pocket costs, so your deductible gets higher. And then real life experience, you've got longer wait times. You know, you want to see the doctor to get your knee replaced. Guess what? Now the wait is double the time because there's not enough physicians or hospitals that take Medicaid. So this bill impacts everyone. It does not just impact those that receive Medicaid. Everyone is going to pay the price. And as Rich Pollack, the CEO of the American Hospital Association, warned, this bill reduces access to care for all Americans and severely undermines our ability to serve the most vulnerable. So a $50 billion lifeline to rural hospitals might sound like it would be some sort of a fix, but it doesn't come close to covering the gap. It's not a policy solution. This tax bill is not a policy solution. It's a heist. And this is a heist because it leads to preventable deaths in our country. Let's show this graphic. It will cost 51,000 deaths annually. And this is an estimate of the preventable deaths. And that's because with this House, the reconciliation bill, you have your loss of Medicaid, your loss of Medicaid / Medicare. You've got the rollback of nursing home shortage, the staffing shortage limits, and then also this expiration of tax credits. So in summary, the tax cuts are costing lives, and we can't afford it. And then this big, ugly bill also adds the work requirement. We talked about this in one of our past eh-yahs. This work requirement sounds great. Yes, we're going to make people work for their Medicaid. But in reality, it's just not true. Supporters claim that it's going to improve employment, but that's not what's happened, right? So Arkansas implemented work requirements. And what happened? 18,000 people lost their Medicaid coverage within months. And that's not because they weren't working. Okay, it's because they couldn't keep up with the paperwork. And what they don't want you to actually know, if you remember this stat, among adults under 65 on Medicaid, and those not including these patients that are on Medicare or receiving some form of disability, 92%. So that's 92% of adults on Medicaid are already working, are in school, are caregivers, are managing health conditions. So really just 8% are out of work for reasons other than retirement or actively looking for work. So let's just nip it in the bud. Medicaid is not a free ride. Medicaid is a lifeline. And just to know that all of this cruelty, it's not just a byproduct, right? This cruelty is the point. And I think that my representative, or one of our New York representatives, AOC, says it best in this clip. Roll it, please.
He's also said some things, he says he doesn't think I'm too much of a smart person. And I'll tell you one thing. It doesn't take a smart person to know if you're being lied to. All right. President Trump, you're either being lied to or you are lying to the American people. On this point of tax on tips, as one of the only people in this body who has lived off of tips, I want to tell you a little bit about the scam of that tax, a little bit of the fine print there. The cap on that is $25,000, while you're jacking up taxes on people who make less than $50,000 across the United States, while taking away their SNAP, while taking away their Medicaid, while kicking them off of the ACA and their healthcare extensions. So if you're at home and you're living off tips, you do the math. Is that worth it to you? Losing all your health care, not able to feed your babies, not being able to put a diaper on their bottom in exchange for what? This bill is a deal with the devil.
Ooh, what do you say, Dr. Sloan?
She
What do you
just gets
say?
me. That woman, I so deeply admire the AOC, the way she speaks truth to power unapologetically and consistently, you guys. She hasn't changed from day one. We know exactly who she is and who she represents. She is about the people for the people. She is the true eh-yah disruptor, if you will, a kind of leader that we need a lot more of. But okay, my admiration to the side, but yeah, she killed that. Listen. Um, we have to confront some other big truths. The big ugly bill, it's not just flawed. It's strategically and intentionally gutting the fabric of America, so-called America now. We don't recognize it anymore. So what's being excluded? Healthcare equity, protections for the vulnerable, the accountability for the wealthy, of course. That's not by accident. Also, the direct result of what? Racist, say it, sexist, yep, and xenophobic agenda that's driven by what? Political power brokers who are rewriting both our history, or should we say erasing it, as well as rewriting the future so they can benefit. This is not policy, it's a power play. And we have to call it for what it is. And so one of the other big concerns that we want to talk about today is this DEI dismantling. It's not quiet now. Hell, it's in your face. And let's talk about what the bill does not include. Something after George Floyd and after COVID and after all these panels and promises of racial health equity, this bill strips all of that, takes it away, not even trying half-ass. It's just wholeheartedly pull it. So no new maternal health protections, specifically for Black and Brown. No community clinical expansion. In fact, rural hospitals, over 400, will be closing. No cultural responsive care initiatives. Hell, we have immigrants literally being taken off the street and no one knows where they're going and what's happening to them. They didn't just forget us. They have deliberately deleted us and are getting rid of us. The DEI funding streams, gone. The equity language, scrubbed. So they say they're streamlining now. And what that really means is pretend that race doesn't affect healthcare outcomes, but we know it does. We know the differences, and acknowledging those differences will kill people. And so our other major concern is, let's talk about it, is health, mental health that's being left behind. This bill has gotten a lot of press with, of course, what's really on the line, that they're still going to get grants and all these hotlines and whatever else, but they've missed the whole point of comprehensive long-term mental health infrastructure. I mean, schools, where a lot of this starts now, is they don't have therapists. The crisis teams are underfunded. Telehealth is gone because it's expired for most patients. And that means that we're not even addressing the workforce shortage, because now with these limitations on student loans, who's going to become the doctors? The wealthy, because the other classes won't be able to afford when they're capping our student loans for medical school. It doesn't enforce parity of law. It doesn't even invest in trauma-informed systems. So what are we funding exactly? PR and the wealthy, which means for the rest of us, more mental health issues, suicides, overdoses, and burnouts are still rising, and there's no end in sight for help. Dr. Brown, this is a sad day in America.
It's as if everyone forgets about COVID, right? We are only as healthy as our sickest neighbor. Remember COVID? You could see someone in the supermarket, and if they had COVID, you can get COVID and bring it back to your family. Like, we are impacted by the health of our communities and our families. But, doesn't seem like this is of concern, right? Because what's actually happening here is that the billionaires are untouched and the patients are paying for everything. And, it's not that the taxes are being raised on billionaires. We didn't touch the carried interest loophole, but we did implement cost sharing for Medicaid. And we did cut back on drug rebates. So yes, someone is paying. Someone's paying. You, me, we are paying. It's just not the top 1%. Did you know that pharmaceutical profits have hit their record highs this year? But insulin caps didn't make it into this bill, that private equity firms can acquire clinics, shut them down, and retain the profits. But working families have to prove their worth in order to get food stamps. It's not fiscal discipline. This is an austerity measure dressed up in some bipartisan flag. It's a wealth transfer from the poorest to the wealthiest. And so, what do we do with that? We name it. we name it, and we definitely don't sugarcoat it. And we do not let the GOP off the hook for co-signing this harm. We all still have a voice. You have a voice. Our call to action is to not be silent. Don't be silent. This isn't a tipping point. This isn't a warning. We are here. We are there. We are there right now. But it's not the end. It's not the end. I want you to see, if we can put up this graph, of who benefits, right? So we're cutting SNAP, Medicaid, and the Affordable Care Act marketplaces for $1.3 trillion. And what's the amount of money for those who make over $500,000? What are they going to get in tax cuts? It's going to total $1.3 trillion. So see this, guys, it is a wealth transfer. It is a wealth transfer.
Yeah, it is. It is. It's now, this is a great graphic to show people how this bill isn't just big, ugly, and bold. It's a retreat. It's a political theater at the extreme expense of human lives. And they don't give a damn. They're cutting the very systems that hold most vulnerable communities together, closing doors, and their smug smiles and sound bites really just hurts us all. But now we mobilize. We can only do so much. But if you organize, you educate your neighbors, you show up at the town halls, you flood the phone lines, the inboxes, this whole grassroots movement has a reason why it has succeeded over and over again. The 3%, right? The 3.5%. So we build the coalitions, we resist, we reshape, we remind people loudly and clearly that poor people, sick people, Black and brown people are watching. We are not invisible and we're not powerless. We're rising and we do vote. Believe that. So keep showing up, keep resisting. And we want to thank all of our Meidas Mighties for watching today. We are eh-yah, the contributors of the MeidasTouch Network. Please subscribe, like, share, and follow for more updates. You guys have a great week.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at MeidasTouch.com/newsletter.